Welcome to the Healthcare Transition Training for Healthcare Professionals, a CME course provided by Florida Hats. The transition to adulthood is a broad process. This curriculum will focus on one aspect of that process, healthcare transition. This training program focuses on the patient's transition from pediatric to adult medicine. Throughout this course, you will meet individuals who have already completed this process. The course uses interactive tools for you to implement the recommendations in your practice. 10 modules make up this course. Each module is about 15 minutes long. By the end of this course, you will be able to define healthcare transition and its significance, identify challenges to healthcare transition, describe policies that affect transitioning youth, and implement strategies to prepare patients, parents, and caregivers for their healthcare transition. This presentation will introduce you to healthcare transition and key concepts used throughout the course. By the end of the module, you will be able to define healthcare transition, explain the importance of healthcare transition for patients, describe the current state of healthcare transition. Here are some important terms used throughout this course. Youth with special healthcare needs have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition who also require health and related services of a type or amount beyond that required by children generally. Throughout this course, we use the terms parents and caregivers interchangeably. Caregivers are the adults in your patients' lives who have parental authority, such as legal guardians or foster parents. The phrase adult medicine is a general term to encompass the primary and specialty practices that serve patients beyond childhood. When talking about healthcare transition, young people and their families often made the following point. Healthcare transition is not a goal in and of itself. Rather, it is one step in the larger process of achieving their life goals. Further, the process of transition supports their efforts at independence, attending college, living independently in the community, and most importantly, having a life. Healthcare transition is the purposeful, planned movement of adolescents and young adults, with or without special healthcare needs, from child-centered to adult-oriented healthcare systems. Healthcare transition encompasses preparation and planning for the move to adult health systems, transfer from pediatric to adult care, and engagement in the adult medical home. Preparation and planning are processes begun by age 14 that occur over time. This allows for the patient to gradually increase responsibility for managing their own health. Transfer is the discrete event of changing to an adult medicine provider. This ideally happens between the ages 18 to 21. Fully transitioned patients are engaged in and receive ongoing patient-centered adult care. In 2011, the three primary care medical societies, the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians, which represents internal medicine, released a consensus statement on the healthcare transition. The definitions and recommendations contained in this course align with the joint statement. For youth, the focus is developing the skills to direct their own care. They must build a sense of control and responsibility for their own health while preparing for the additional rights they will gain at age 18. Making the transition from pediatric to adult-oriented healthcare is especially critical for youth with special healthcare needs. Some patients may never be able to make legal or medical decisions independently. Others may need a caregiver to complete physical tasks. Yet, these patients will become adults. They are not exempt from transition. Preparing all patients to direct and manage their care to their fullest capacity is critical. During this course, we will examine many barriers that transitioning youth with special healthcare needs face. Many of these focus on the differences between pediatric care and adult care. This includes medical care and social services. Youth and parents or caregivers must prepare to navigate these differences before they arise. Pediatric providers play a critical role in facilitating successful healthcare transition. For providers, the challenge is to work in a coordinated fashion so that patients receive continuous, coordinated, developmentally appropriate, and responsive healthcare. Through the healthcare transition process, families must facilitate growth and development in their child. The process of letting their child grow and letting their child go can be especially challenging for parents or caregivers of children with complex conditions. What is the importance of transition? Does the need justify all of these considerations? Consider your waiting room. Are there ducks on the wall? Little chairs sized for your youngest patients? Your office is surely a wonderful pediatric environment, which reinforces the reasons your oldest patients might feel uncomfortable there. The move to adult care promotes normal social and emotional development, supports a positive self-image and self-reliance, promotes independent living, and broadens the young person's system of interpersonal and social supports. With improvements in medical technology, the life expectancy of children with special healthcare needs is well into adulthood and, in some conditions, equal to that of the general population. About 500,000 individuals with special healthcare needs turn 18 every year. The next two slides provide examples from specific conditions. In the 1950s, few children with cystic fibrosis lived to see elementary school. Children born today with CF have a predicted mean life expectancy into the early 40s. As of 2012, more than 45% of the CF patient population is age 18 or older. Life expectancy for people with Down syndrome has increased dramatically in the last 30 years. In addition, patients with Down syndrome experience accelerated aging in their 40s and 50s. This increases the importance of their transition to adult medicine. Perhaps you do not see a high volume of patients with complex conditions like CF or Down syndrome. You may wonder if transition applies to you. Think about other, more common conditions that you see in your practice. Patients with comparatively simple conditions must also learn to manage medications, navigate insurance, and access specialty care. All patients need transition preparation. Due to this growing need, healthcare transition is a national priority. Improvements in transition care are built into the Healthy People 2020 goals and the Maternal and Child Health Bureau's outcome measures. The reality of transition is reflected in federal laws like the Americans with Disabilities Act and the Individuals with Disabilities Education Act. The National Center for Healthcare Transition Improvement, established by the MCHB, provides resources to achieve these national goals.
I think from my experience, I can definitely recommend to others going through the same thing, not to give up. There are going to be times that it's going to seem so overwhelming and so insurmountable to be able to do this by yourself that you're going to want to quit, but don't do that. I think another key thing to think about is get involved early. Become integrated with your healthcare very early on in life. I think.
When you say integrated, what do you mean? Can you give examples?
Well, when I say to be integrated, I mean like instead of having your doctors talk to your parents or just to your parents, have your doctors talk to you. The patient, because after all, they're performing the surgeries or what have you on you. So that is that's more or less what I mean by becoming integrated. Is just take charge almost. I mean, it's your healthcare. You should really be the one playing the key role in it.
Any other recommendations?
I think just keeping a positive attitude. I think that's really what it's all about.
We've seen the need for healthcare transition. Now let's look at evidence on the current state. Does it need improvement? Discharge from pediatric care is frequently abrupt without planning or preparation. Rather than being based on a young person's readiness to negotiate the adult healthcare system, discharge is often precipitated by external factors. These include hospital or insurance policies limiting pediatric care to children under the age of 18 or 21. In other cases, the pediatric practice feels unable to address a patient displaying adult behaviors. The behavior, or the inability to address it, prompts a rushed transfer to adult medicine. In both situations, transition takes the patient and family by surprise, leaving them with a feeling that they've been kicked out. Have you discharged patients after they reach adulthood? If yes, what factors have led to their discharge? A practice or hospital-wide policy? A specific patient need or behavior? This slide will automatically advance in 1 minute, giving you time to jot down your answers to the questions on this screen. In the current state, transition outcomes commonly fall into one of the following categories: everything stays the same, mixed transition, full transition, and dropping out. Some patients continue to receive both primary and specialty care from the same providers and facilities after they reach age 21, so their care appears to stay the same after they reached adulthood. Consider the biopsychosocial differences between a 21-year-old patient and a 38-year-old patient. How long is it acceptable to assume that everything stays the same? Some youth transfer their primary care but continue to see their pediatric specialist. There is a known shortage of adult-oriented providers familiar with childhood-onset conditions. This shortage causes difficulty in finding adult specialists who accept transitioning patients. For example, many adult pulmonologists are not familiar with the care of individuals with cystic fibrosis. Remember, young adults with special health care needs is an emerging population in adult medicine. We will discuss this barrier to transition in greater detail later in this course. Key to a successful full transition is careful planning, the development of healthcare skills by the young adult, and good communication between all of the pediatric and adult healthcare providers. Some youth fall through the cracks. Dropping out from pediatric care is most likely to occur upon discharge. Dropping out of adult medicine is more frequent if the patient experiences an early barrier with new providers. Many pediatric providers never find out if their former patients drop out of care. They are not aware of the size or significance of this problem. In later modules, we will examine how to avoid this outcome. Next, we will examine barriers specific to providers, patients, and caregivers. Many pediatric providers do not know how to broach the topic of transition, afraid of the patient's reaction. Other providers, sensing parents' fears of the unknown, don't know when to broach this topic. And if the pediatrician lacks a strong referral network in adult medicine, they may not want to begin the process at all. Many providers inadvertently create new barriers trying to avoid the others. External factors often step in to create an abrupt transfer, made more difficult if the patient is not prepared for transition. Many providers develop a strong bond with patients, especially those with complex conditions. It is natural to want to protect patients from uncertainty. Some pediatricians go so far as to explicitly promise not to discharge or transfer care. This makes an abrupt transition even more calamitous for families and patients. Finally, by directing important communication solely to the parent or caregiver, the provider leaves the patient unprepared for adult medicine, where parents are typically not part of the visit. Your patients are probably not excited about reading their EOBs, learning how to find an in-network provider, or going to the pharmacy on their own. The main barrier for youth is the fact that healthcare is boring and complicated, yet it is vitally important. Many families do not understand why their child cannot continue to receive care from pediatric providers when they reach adulthood. They do not fully appreciate that pediatrics is a specialty, trained in the care of children and adolescents, but not adults. Their fears that the child will not properly manage their condition or that the new provider does not know enough about their child's condition is their main barrier.
An experience happened to me about 3 weeks ago where I entered Cottonwood emergency room about 11 p.m. at night. having an anxiety attack. They didn't ask me what was wrong with me. They asked my friends that took me. Now, as I thought I was coming here today to speak with you guys, I thought, now that's wrong. Who's the patient here? So I kind of got stern with the nurse and the doctor. I says, who's in the bed? Who's wearing the gown? Do you see him wearing a gown? No. I'm wearing the gown. Talk to me. You know, because what you see a lot of is the people that can talk, they don't get to talk to the doctor. And that's because the parents are either in the room or just being parents and being nosy.
To be successful, healthcare transition must be a long-term planned process that attends to the medical, psychosocial, educational, and vocational needs of the patient as they move through adolescence to adulthood. We have mentioned the healthcare transition process several times throughout this presentation. In the remaining slides, we will describe that process and introduce you to 3 frameworks to guide its implementation. These 8 steps are the heart of the transition process. This algorithm comes from the 2011 Joint Statement. It identifies specific tasks in the transition process by age with considerations for youth with special healthcare needs. The National Center for Healthcare Transition Improvement provides 6 core elements of transition based on your practice setting. Whether you specialize in pediatrics, family medicine, internal medicine, or specialty, there are key strategies to assure your patients have a smooth transition. Like the Joint Statement, references to the 6 core elements appear throughout the course. This is the Florida algorithm for youth and young adults with special healthcare needs from Florida Hats. It closely matches the algorithm from the Joint Statement. The Florida algorithm includes state-specific considerations and tools. We will use this guide throughout the course to implement the 8 steps. In this section, we will discuss general guidelines to introduce this topic with parents or caregivers and patients. The earlier the process begins, the more likely patients are to take responsibility for their own care as a young adult. It is best to introduce this topic around age 12 and no later than age 14. The Florida algorithm provides age-appropriate steps for all stages of adolescence. The best time to introduce transition is during a time of health instability for the patient. Well visits and follow-up contact provide opportunities for transition conversations. Urgent care or post-hospitalization visits are a bad time to broach this topic. Save transition for a 4 to 6 week follow-up visit in these cases. What kinds of visits will you use to discuss healthcare transition? Is there a specific time of year that adolescents are more likely to schedule a well visit? Less likely? This slide will automatically advance in 1 minute, giving you time to jot down your answers to the questions on this screen. Before closing this module, let's look at resources for your practice. The Florida Hats website has the latest news and tools on transition. The toolbox offers practical resources for multiple audiences. There are 4 regional coalitions within Florida Hats: Tampa Hillsborough, Northeast Florida, the Panhandle area, and South Florida. These regional coalitions can link you to local resources. The National Center for Healthcare Transition Improvement's website is called Got Transition. It provides national news on transition research and events. GotTransition.org also provides a database of tools and resources. Filter the database by tools for youth, for families, for providers, or by state. Throughout this course, you will see these key points from the introduction. We've already discussed these 3 key tools. Use the links from this course's toolkit to download or print copies for use during the course. Now that you are familiar with the basics of healthcare transition, let's examine the relationship between transition and adolescent development in Module 2. You can pause the presentation for a quick break or continue directly on to the next module.